Other places around the world may not have the same level of oversight. But as we see from the shutdown of Abbott, we still have to do more. I hope you all continue to report this, because when just a handful of companies can control the supply of something as essential as baby formula, this is not toilet paper.
Oh, I hope you people keep staying on top of this and keep reporting this, because a handful of companies control the supply of this very critical product. Okay, what does that have to do with anything? You shut the plant down. You caused the shortage.
Don't blame me. I didn't do it.
This is diversion. He's diverting the topic.
And you need to have a supply readily available. We need to make sure that they're on top of it. If they're not policing themselves, then we have to do more to make sure we are doing the right thing for parents who need that supply.
Oh boy, if the companies are not policing themselves, then we, FDA, have to make sure that they're staying on top of it. Okay, but they were policing themselves, and there was no contaminated product that went out. And you, FDA, you shut them down, and you caused a nationwide crisis that's going to continue on for another couple of months. I don't know what to say.
Yeah, otherwise, I mean, we could continue to see these sort of things continue to happen. Mr. Secretary, how much baby formula is being brought in from other countries? And I ask this to ask, if we have the capacity right now to meet parents' and babies' demands as needed.
Yeah, so we are working aggressively with some of these companies, including companies that aren't necessarily part of that small network of companies that usually provide the domestic supply, to see if we can bring some more in. You heard about the Nestle supply that came in recently from Switzerland. We made that possible. Essentially what we did was we accelerated the ability to get that product into the U.S. rather than run its usual course under a very bottleneck supply chain. We're going to do that because we need it now. But again, we don't produce it, so we can't control how much there will be. What we can do is try to break all sort of impediments to make it possible to bring it in as quickly as possible.
So HHS and then FDA reporting to them says, we don't produce it. We can't control how much is available. Wait a second. You shut down the plant. You shut down the plant because babies were dying, quote unquote, from bacteria contaminating the product. But there was no bacteria contaminating the product. You created the shortage.
Oops.
Oops. What does that mean? What do you mean?
No, I got it. Some jerk didn't put.
I know what I
got it, though.
mean when I say oops. What do you mean saying oops there?
Well, you say we try that one again, huh?
Yes.
Now you're to the rescue, and the president has the military flying in shipments, and you show the military people in military fatigues with the forklift bringing in pallets of who knows what. You created the problem. You're not to the rescue. You're the instigator. You're the cause, FDA. I'm sorry, folks. Maybe I'm over. I get worked up. I can't stand when people are trying to deceive the public.
Up to them to produce and distribute. And, you want to be a very consolidated market. You want to have essentially a corner on all the market. Then be responsible and make sure the product's available.
Do you hear this? Do you have to go back and play that clip again?
You want to be a very consolidated market. You want to have essentially a corner on all the market.
Then be responsible and make sure the product's available.
You want to have a consolidated market where just a few of you supply the whole market. Then you have a responsibility to make sure that there's supply. He's trying to push the blame on the manufacturers. First of all, why is there a shortage of supply? Because FDA shut them down. It's not because the manufacturers couldn't produce enough, it's because FDA shut them down. The guy is telling you right now that it's the industry's fault. He shut them down. He caused the problem. And then he says also, over the manufacturers, they want to have a consolidated market. What do you mean manufacturers want to have a consolidated market? Anybody can get into the market and make baby formula. You want to invest the money and bring in the expertise and go through the risk and develop a CGMP compliant manufacturing facility and apply to FDA? Go ahead and do it. There's no claim that there's antitrust activity going on here, that they're keeping anybody else out of the market. He's just making up a false scenario to blame the industry when FDA's own website and the CDC's website shows that FDA shut down this plant and there was no contamination of the product.
The industry is a mature industry. They make a lot of money. They should be able to make that product available when it's needed.
Now the industry are the bad guys because they make a lot of money, he says. Well, we hate people who make a lot of money, right? And they should be able to provide the product when needed. You shut them down. They can't produce the product if you shut them down. And you shut them down because the baby formula was contaminated with bacteria and killing babies. But it wasn't. Your own website says that it wasn't. This is unbelievable. And the press is letting this guy get away with it.
Parents need that. And in some cases, some of that baby formula is the only thing that some of these babies can actually consume. And so there's a responsibility. If you're saying you're going to let the private market provide that, then the private market has to step up. You cannot afford a market failure, as we've seen today when it comes to baby formula, because lives can be at stake.
Whoa, there's the Secretary of HHS. We cannot afford a market failure. There was no market failure. It was an FDA failure. It was your agency, the FDA, that caused the failure. It wasn't a failure of the manufacturing companies. Show me any market which is not going to have a shortage. The government goes in and shuts down enough of the manufacturing capacity. The FDA should have known this before they go shut down a company for contaminating a product and killing babies when the product in fact was not contaminated and the babies did not die from that. He's acting like holier than thou and standing on his platform and telling the industry it's their responsibility. You did it. You FDA did it. You HHS, you did it. Your website even says it.
And so we're going to do everything we can. We've actually, from before this crisis began, for more than a year, we've been asking Congress to give us more authority to really be able to take a closer look behind the curtain at how the industry operates.
Oh, so the response to FDA failing by going in and inspecting this plant and causing them to voluntarily shut down, the response is that FDA should get more authority. Well, it looks like you didn't need more authority to go in and shut the place down. Again, this is misdirection. And also with government agencies, as I told you in the last video, and I've had decades of experience with government agencies, the number one priority of government agencies is to get more money and more power for themselves. And they live and die by the regulations. Whatever the consequences are, not my issue. Well, now it is your issue. Because once again, you overstepped your bounds and you've caused a major catastrophe to occur. We need more power. We need more authority. No, I think you need less. Look at how Congress reacts to FDA messing up and causing a baby formula shortage, which has now caused babies to be hospitalized.
The bill is passed.
House lawmakers approved 2 bills Wednesday night. One would provide $28 million to the Food and Drug Administration to prevent future formula shortages.
This bill just continues the Democrat strategy of throwing money at the same bureaucrats who caused the crisis.
Yes, folks, the FDA and the HHS try to cast off the blame for their error causing the baby formula crisis. And they also then say they need more power. And what does Congress do? Congress passes to give them more money. So in government, if you fail, if you mess up, if you cause a crisis, you get more power and you get more money. This congressman is absolutely right. FDA should be reeled in over this. They should be punished because of this. They should have money cut from their budgets. And I have to leave you with one big question. What are the consequences to FDA inspectors for writing false, quote unquote, violations, for taking action incorrectly against a company, hurting the company and also now hurting babies in our country? Can't be that FDA gets more money and more power. This is not right. Please tell me in the comments how you feel about this. What do you think should be done to FDA for causing this crisis unnecessarily? And what do you think should be done to HHS for trying to cover up what's going on and who caused it? This is really atrocious. Am I upset? Yes, I'm upset. This isn't right. This just isn't right. Thank you for watching my YouTube channel. As I've told people before, if you want to contribute, there's no way to contribute. I don't commercialize it. I don't run commercials on my videos. There's no place to donate money. There's no merchandise. I strictly do this for you. I care about you and I want to help the people, help our country. Thank you.